Hello, I'm Rishika, and my research was an in vitro analysis of Chitosan-Insulin nanoparticles for oral insulin delivery in order to pursue a non-invasive treatment of diabetes in the senior biological B category. Diabetes is a disease that affects millions of people worldwide. This devastating condition is characterized by high blood glucose levels due to insulin deficiency. In order to maintain these blood glucose levels, typically insulin is delivered subcutaneously in the form of injections and insulin pumps. However, this has extreme low patient compliance due to the pain and complexity of the insulin treatment. Non-invasive treatment of diabetes has been a focus of research for decades, and now we have a solution that with further research can save millions of lives. While insulin is not effective alone due to insulin degradation in the GI tract, chitosan has many properties that render it the best option to be used with insulin when preparing nanoparticles. In self-assembling the Chitosan-Insulin nanoparticles, I did not use any harsh chemicals. I also determined many of the physicochemical properties of the nanoparticles to determine the best chitosan-insulin weight ratios to be used and how to improve insulin retention and release at the right times in the GI tract based off of simulated pH levels corresponding to those in the digestive system. And my in vitro analysis was successful as the 1:1 rate ratio demonstrated the best insulin retention and release at the right times. This non-invasive method is more efficient, cost-effective, less complex, and has the potential to improve the lives of millions. With my in vitro analysis of chitosan-insulin nanoparticles for oral insulin delivery, we can pursue a non-invasive treatment of diabetes. Thank you.